Hello, I'm Susan Cole.
And I'm Matthew Hodson.
And welcome to aidsmapCHAT, our show bringing news for people living with HIV all around the globe.
We've got another very exciting lineup of guests this week. We have Linda-Gail Bekker, who's one of the top HIV doctors in the world. She's a director at the Desmond Tutu HIV Centre and is also a former president of the International AIDS Society. She's a big deal. And we have Edwin Sesange. He is a Ugandan man who's living in the UK, and he is a director of the African Equality Foundation, who does work with LGBT communities from Africa. And we also have Todd Cooper, who is a final year medical student, and he did some data analysis of COVID outcomes for people living with HIV, which is then being utilized by the World Health Organization. He's currently doing frontline work in the COVID wards, and so we're very excited to have him as a guest as well. So that's our lineup for this week.
Fantastic, very exciting show. So Matthew, Happy New Year, and how have you been?
I have been okay. I think as with everybody, it's been tough, and I can't pretend it hasn't been tough, because in the UK here we're in lockdown again. We anticipate that we're going to be in lockdown for at least a couple of months, and I think it just is starting to get to me, and so I'm trying to look after myself as best as I can. And one of the things that I've been thinking about is that actually now that I can't actually see anyone in person, my whole life, my work life and my social life is carried out online. And one of the things that I've been doing recently is I've been just trying to make sure that I make that environment as easy and as good and as pleasant an environment as it can be for me, because I need to look after my own self. I need to look after my own mental and emotional health, because this is a big challenge. How are things with you?
Yeah, I mean, I'm okay. I think a very different kind of Christmas, because as you said, we're in lockdown and can't get together with everyone, but the biggest challenge for me continues to be the fact that I live in a multi-generational household. So I'm with my mum, who's 86, and then teenage children. So it's a bit of a challenge trying to balance everyone's well-being. But I do feel really fortunate, because I have a job where I can work from home, but so many people in my community are just being devastated by COVID. They have no choice but to go out and be exposed more, and it's just rampaging through the community. And in fact, a very good friend who is a beacon in the HIV community is currently on a ventilator and in hospital with COVID. So it's awful. It's a tough time for everyone. But we're so close with the vaccine. So
Yeah, I just can't wait. And I really hope that. Well, I mean, I'm just really looking forward to getting it myself. In the UK, people with HIV have been prioritised. We're in group 6. I'm not sure when exactly that means that we'll get it, because I think they're saying the first 4 priority groups they hope to do by mid-February. But I'm just like, please just pump it into me. I want it as quickly as possible. Oh, don't be rude. Shall we get a guest on?
Let's bring on a guest.
Okay, so our very first guest is Linda-Gail Bekker, who is one of the top HIV doctors in the world. Hi, Linda-Gail, how are you?
Hi, Matthew. Hello, Susan. Nice to see you.
Lovely to see you, Linda-Gail. And thank you for coming on again.
Yes, always a pleasure.
So, I've been just moaning about the COVID situation here in the UK, but the COVID situation is pretty bad in South Africa as well at the moment. Is that right?
So we're also in that, proverbial second wave, Matthew, and it's moving with wildfire throughout the country. I'm in the Western Cape, and we've seen a peak twice as high as we did in the first wave. It looks like we've just peaked on our cases, so that at least is good news locally.
Right. And what are the living circumstances in South Africa right now? I mean, are people still able to work? Because that was a challenge before.
Correct. So we've been lucky. Our president meets with us every 2 weeks. They become known as the family gathering. He very much is the father figure, gathers us around and tells us, what's good for us. And it seems that what's good for us at the moment is to be in lockdown 3, which means there is some limitation on movement. There's limitation on large gatherings. We can't go to the beach. We can't go to parks. And we aren't allowed to drink at restaurants or in public or anywhere, and we're under curfew. So people have to be home by 9 and off the streets until 5 a.m. in the morning. So it's tough. Again, as Susan was saying, a lot of folk really struggling under the circumstances. So it's tough.
And Linda, what do we know now about how COVID affects people living with HIV?
Well, the other news is that we are, like yourselves, experiencing a new variant. So we have a new kind of SARS-CoV-2. It has undergone some mutations. Those of us who live with HIV know that very well. We're always fearful of new mutations, and this is exactly what's happened with this virus. It's also an RNA virus. And it has undergone mutations. We have the South African variant. You guys have the UK variant. WHO has just said, please don't call them by their country. So I know they're trying to look for new nomenclature because we don't want to stigmatize viruses either. But the important thing is that this new variant appears to be very transmittable. And that's why it's spreading with such fervor, and it's really moving throughout the country. It is, however, it doesn't seem to cause more severe disease. So that is good news. And we're seeing, as we did in the first wave, about a 2-fold increase in disease for people who are co-infected with SARS-CoV-2 and HIV. So living with HIV, you become infected with COVID, we're seeing a 2-fold increased rate of severe, more severe disease requiring hospitalization, etc. And that has not changed in the face of the new variant, it would seem. So obviously new data comes in every day, but that's hot off the press from the group here in the Western Cape who've been looking at this.
That's quite challenging, isn't it? Do you think that there are lessons that we've learned from dealing with HIV that can be applied to COVID?
Definitely. So, we've had a very heavy hand. Just today, I was tweeting about the fact that sadly, our Minister of Police is quite militaristic. And, if you're caught in public not wearing your mask, not only do you get a fine, but you get a police record at the moment, which seems incredibly tough. And my response to that is one thing we learned in HIV is that it is much better to appeal to people's personal value and a sense of gain personally to get them to change their behavior rather than to come with a loss frame, do this or some terrible thing will happen to you. So I think that was the one thing. The other thing is not stigmatizing individuals and driving them underground. I think we really learned that during HIV. And my third big lesson that I've been harping on about is that community needs to be involved in all of these responses, including in vaccine rollout. And I'm just not hearing enough connection with community and community-led organizations to say, how are we going to roll out this vaccine when it finally comes to our shores? It hasn't yet. So, boy, we're so jealous of you guys. But when it does, what are we going to do to get to the 67% of our population who needs it? So those lessons, I think, are just huge, and we seem to have missed them for COVID, which I think is a problem.
And when do you think that you're going to be getting the vaccine? Because the inequity with the vaccine is just absolutely shocking.
Yes, there's the other lesson. So we kind of thought this might happen. And so we have been harping about this since about September of last year to say, where's the vaccine plan? What's happened to the patent pools? What are we going to do about, making sure that this innovation is shared with generic companies, etc. Unfortunately, that seemed to land on deaf ears, and we seem to be quite far in the back of the queue. And so after much cajoling, it does look like we'll get at least 1.5 million doses for our frontline healthcare workers sometime in the next month or so. And that's going to be huge. It'll be a big morale booster. We have to get vaccine at least to our clinicians and nurses as soon as possible. For the rest, I think it's going to be sometime during 2021 and beyond.
Gosh.
Wow. Linda-Gail, thank you so much for coming on the show. It's always a real pleasure to talk to you. We wish you all the very best, because it's difficult for us all, as we said. So,
Thanks so much.
Thanks to AIDSmap. Take care, all of you, and up AIDSmap.
Yeah.
Thank you.
Thank you.
I love it when people say nice things about AIDSmap. I think every guest do that.
Yeah, absolutely. I think everyone needs to say up AIDSmap.
Yes. So, I mean, and talking of which, I guess, kind of we can talk about some of the stories that we've been publishing on AIDSmap. And there has been, I guess, kind of generally in the last few years, there's been so much good news. I mean, kind of really good news about life expectancy, good news around things like injectable PrEP and stuff like that, which could be real game changers. But we have been reporting some kind of slightly, well, not slightly, I mean, kind of some kind of quite worrying data. We've seen much higher levels of dementia and earlier onset of dementia amongst people living with HIV was one story. And there was also a story about much greater risk of cervical cancer.
Yes, women with HIV have a 6-fold increase risk of cervical cancer. And initially, I was quite concerned to hear about that. But however, cervical cancer is the most preventable and curable of the cancers. And in fact, WHO thinks that we can eradicate cervical cancer by 2030. But a concern for me is the fact that with COVID, I think we're seeing a real issue in terms of people, having smear tests, and if people, have concerns around cancer, actually getting the testing and the treatment. So it's a challenging time. But that's a message to healthcare professionals. Don't forget about these other issues. People still need help beyond COVID.
And I think it's a message for everyone, isn't it? I think the NHS is very much saying, yes, we are being really challenged by this, but we still need people. If you've got symptoms of cancer or other conditions, you still need to come in, because it's going to be much easier to treat those conditions earlier than later.
Mm-hmm. Absolutely.
Well, on that cheerful note, let's get on someone who's been really working hard for his communities. Our next guest is Edwin Sesange.
Hello, Edwin.
Hello, Susan and Matthew.
Hi.
Greetings to all of our viewers and listeners.
It's wonderful to have you on. Edwin, you work with people who are asylum seekers and refugees
Yes.
from LGBT communities. What challenges are you hearing in relation to COVID? How is it affecting the communities that you've been working with?
Thank you so much, Susan. Our community, we've been facing, or they've been facing many problems before COVID came in. So one would say that COVID made it worse. So people who are seeking for asylum in the UK, especially those who identify themselves as LGBT, identify myself as a bisexual man. So the problems that we are facing because of COVID, I would say, for example, I'm going to point out one case. We have a service user who is living with HIV. But when you look at the living arrangement, they are sharing a room with another person, because the Home Office put them together. That's the living arrangement from the home office. So with COVID, with the lockdown, so they have to stay together in the room before they could move. So this person told us they had to get on the phone with the doctor. The other person was in the room. So he had to, he tried to go to the kitchen. Somebody else was cooking. He tried to go to the toilet. Just like a couple of seconds, somebody knocked. So he had nowhere to go to speak to the doctor. So with COVID, it brought the lockdown. And with our community, that meant loss of privacy. Though we didn't have enough privacy, but it got lost because now you have to share everything with your roommate. So we also have other challenges. For example, communication. As you know that it's now very hard to go to GPs. You have to call in first, and they have to do a video call. So that means you need to have mobile data. That's quite expensive for someone who is not working. So some people cannot access their doctors because they don't have mobile data. So it is a necessity now to have mobile data. So some people have missed their appointments with the doctors because they cannot reach to their doctors because of lack of mobile data. Then it comes to lack of essential needs. As you know, you need to look after yourself, you need to eat well, you need to have other needs as a person. So some of our members cannot afford these basic needs. Though we try as much as we can to provide. So we've had people suffering from COVID, and some of them are living with HIV. So they are in isolation. They cannot do shopping online because they haven't got the facilities, and they've been told, don't leave your house. So you cannot leave your house, you cannot do online shopping. How are you going to survive?
And this is the challenge we keep on coming up against, and also I think it kind of relates to what Linda-Gail was saying, is that the way we can get out of this incredibly challenging situation is when we ensure that all people are informed, equipped, and empowered. And part of that being equipped, it means that we need to make sure that people are able to feed themselves. And if we're saying that people can't leave their homes, have to make sure that they've got food on their tables, because otherwise they are going to leave their homes.
Exactly. So we've managed to provide food and other essentials to some few members because we haven't got enough resources. We thank those who've managed to fund our work, but we need more support. And again, this I think ties in with Dr. Linda, that we need the community to work together. We need the community to work together because without the community, I don't think nothing much can be achieved.
I do want to raise, because there's obviously an election going on in Uganda at the moment, and the President Museveni recently described in an interview, he described LGBT people as a deviation. I mean, and that's presumably that kind of homophobia. That's what you're dealing with. What impact does that have on the HIV response in Uganda?
Well, it's been tough before COVID. Actually, before last year, it was tough. But COVID came in, and then campaigns came in as well. So that mixture isn't good because, as we saw in May, that 23 people were arrested, 25 people were arrested, and also accounts of organizations which give support to people living with HIV and those who identify themselves as LGBT were frozen. Then we are seeing the president and other politicians making such homophobic statements. So these homophobic statements really affect our community, and it affects the way they access services. So I was speaking to one person today, actually, and they told me that they went to a doctor, and the doctor said, you need to have a COVID test first. So a COVID test in Uganda is not expensive. It's not like that. It's not cheap. It's quite expensive. Mm-hmm. So some of these people haven't been working. So they are living with HIV. They've gone to see a doctor. A doctor needs a COVID certificate. They cannot afford it because it's not free. So Uganda now, with all the statements and the inability of the government to offer services to the less privileged people of our community, I think is really, really appalling. And yes, we hope that Bobi Wine wins. But if he doesn't, then we need to do more for our community. We need to do more for our community.
Thank you, Ed. It's really great to know that there are people like you who are working and supporting those communities. So thank you very much. And thank you so much for coming on the show.
Thank you, Edwin.
Welcome. You're welcome.
So our next guest is Todd Cooper, who is a medical student. He's in his final year as a medical student, and he has been put in the position of going on to the COVID wards as part of his studies. Hi, Todd. How are you?
Hey,
hi, Susan. Hi, Matthew. Hi, everyone at home.
So, how has it been to be studying medicine in the midst of this crisis?
Yeah, so when I applied to medical school, I don't think it's anything that I would have ever foreseen, a global pandemic of this kind of magnitude. And a lot of teaching has gone kind of by the wayside now, and we're stepping up and doing a lot of things that maybe we wouldn't have done before. So helping out doctors, preparing notes and things like that, really trying to get prepared to become junior doctors ourselves, but also supporting healthcare systems wherever we can.
And so how's morale in the hospital at the moment? What's it like?
Well, it's quite strange at the moment, actually, because I've only just started going on to the COVID wards. I was out in the community before this, so I've kind of come onto the ward quite refreshed, quite energized. But on the COVID wards at the moment, everyone is very tired. We are in, hopefully, the peak of this third wave, but who knows really if it's going to get worse before it gets better. And I think everyone's just very, very tired now. It's gone on for a long time and it just seems to be getting worse. So we have that kind of light at the end of the tunnel of the vaccine, but
it must be so frustrating when there's people denying that there is even a pandemic going on, and you're working for that.
I think you mentioned one of the tweets that I tweeted earlier in the week about coming onto social media and seeing people at parties and raves and things like that, and then it's almost insulting really when you go onto the wards and you're holding patients' hands as they're passing away, which is something that I'd never had to do before this. And then when you see people are at parties and things like that, it's really, really sad. And you have to feel for the patients who are going through it themselves, but then also their families, and then the healthcare professionals who have to put their lives at risk as well to help people. It's really sad.
But Todd, you've done some quite exciting research. You've been published recently. So what do we know now about how COVID has been affecting people living with HIV?
Yeah, so it was interesting to hear what Dr. Linda-Gail was saying about the research coming out of the Western Cape, because our systematic review was done quite early on in the pandemic, and we didn't have a full picture, particularly of what was going on in Africa, which is something that we wanted to look more into. Our systematic review originally found that people who were undetectable and had good CD4 T cell counts weren't at higher risk of poor outcomes than the general population. But there was this massive kind of gap in evidence from Africa, from South America, and from any patients who were living with AIDS. There wasn't much evidence around that either. So we were kind of encouraged that we could support the U=U message and get people to really kind of try and suppress their viral loads by saying that hopefully you weren't at risk of poorer outcomes of COVID if that was the case. It was really nice to hear about HIV clinics in the UK using our research as well to reassure their patients. That was a nice thing to hear back.
I mean, we were talking earlier on in the show about some of these conditions which do affect people with HIV more, but always viral suppression is always a factor. And I mean, it's another encouragement to ensure that people are tested and to ensure that people are involved in, fully involved in medical care, and that they take their treatment and adhere to their treatment, because viral suppression for every condition. You're going to be better off if you're virally suppressed. If you're living with HIV, you want to get that virus down to as low levels as possible.
And I think as a medical student, kind of conversing with medical professionals, people who aren't involved in HIV care, still that message really needs to be pushed to them about U=U and how great the outcomes are now, and about how HIV has changed. And I think that the more research that can be put out in that way and to support that message, the better.
Yeah, because you were started off by doing a piece of research on U=U, didn't you? So
yeah.
U=U, undetectable equals untransmittable, is the knowledge we have that when someone is virally suppressed, they can no longer pass the virus on.
Yeah, so that's where kind of my interest sparked in HIV research, really. It was at my local hospital. I wanted to just see how clinicians were communicating the U=U message. So we had a look at the patient notes to see if it was being documented and what kind of conversations were happening. And I think from that, we learned that there was a little bit of an expectation that patients just knew about U=U. But hopefully we kind of reinforce that it should be consistently integrated into patient care, the message, because it does improve adherence to medication and also reduces stigma, and kind of gives people that confidence to know that if they're virally suppressed, then, they're not going to have the effects of the virus.
And it's such good news. And it's one of my little pleasures in life is sometimes I see tweets or comments from medical professionals, and they say things like, oh, I just told someone about U=U for the first time, and there's tears, there's laughter, there's happiness. It's a message which is full of joy and a message which is full of hope. And right now, I think we all need some of that in our lives.
Yeah, the more good news stories, the better.
Thank you, Todd, so much. Thank you so much for coming on.
Thank you, Todd.
Thanks for having me.
And I think we are about to run out of time. We've just whizzed through.
I know. It's like I turn the camera on and then I blink and then we're saying goodbye.
Well, but we will be back in 2 weeks' time.
That's right. We've got our next couple of shows lined up. So I hope that you can join us in 2 weeks' time, which is the 28th of January, 6 o'clock GMT. Also, if you've enjoyed watching the show, please spread the word, retweet it, or talk about it and get other people to watch it, because we love the viewers.
Yeah. So huge thank you to all of our guests. Thanks to Disruptive Live for their technical wizardry. And thank you to Wandsworth Oasis for sponsoring this broadcast. So we will see you in 2 weeks' time.
Take care of yourselves.
Bye.